Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Does Qulipta cause weight loss? You may lose some weight if you are taking Qulipta. Studies in over 2,600 patients have shown that 3.2% to 5.3% of patients taking Qulipta lost at least 7% of their body weight, compared to 2.5% of those taking an inactive pill, placebo. As an example, a 7% weight loss in someone who weighs 150 pounds, 68 kilograms, is 10.5 pounds, 5.3 kilograms. What is the average weight loss on Qulipta? The percent of people who lost at least 7% of their weight at any point during 6 to 12-month-long studies was 5.3% of people taking the 60 mg dose, 3.2% of people taking the 30 mg dose, 3.8% of people taking the 10 mg dose, 2.5% of people taking the placebo, inactive pill. The recommended oral doses for Qulipta, atogepant, are 10 mg, 30 mg, or 60 mg taken once daily for prevention of episodic migraine, 60 mg taken once daily for prevention of chronic migraine. You can take your dose with or without food. Dose adjustments may be necessary for patients with kidney disease. Tell your doctor if you have any problems with your kidneys. Why does Qulipta cause weight loss? You may experience side effects like nausea or loss of appetite while taking Qulipta, and this may contribute to weight loss. In studies, up to 9% of patients taking Qulipta experienced nausea and loss of appetite occurred in up to 3%. Nausea is considered a common and dose-related side effect with Qulipta. Nausea is also a known symptom of migraine headaches. In Qulipta studies, nausea occurred in 9% of those taking the 60 mg dose, 6% of those taking the 30 mg dose, 5% of those taking the 10 mg dose, and 3% of those taking the placebo. Less than 1% of people in studies stopped treatment due to nausea, and this side effect may improve over time. A decrease in appetite also occurred, but less frequently than nausea. Loss of appetite occurred in 1% to 3% of patients taking Qulipta, compared to less than 1% of those taking a placebo. In general, Qulipta is well tolerated by most people. The most common side effects, occurring in at least 4% of people and greater than placebo, are nausea, constipation, and fatigue, somnolence, feeling tired or sleepy. Related questions: how do Ubrelvy Qulipta and Nurtec compare for migraines? What are the new drugs for the treatment of migraines? How long does Qulipta take to work? What can I do? Contact your healthcare provider if you notice unexpected weight loss or nausea while taking Qulipta. Your doctor may adjust your dose, suggest you take your dose with food, or further assess your migraines to determine if a change in treatment is needed. Learn more: how well does Qulipta work for migraine? This is not all the information you need to know about Qulipta, atogepant, for safe and effective use and does not take the place of your doctor's directions. Review their full product information and discuss any questions you have with your doctor or other healthcare provider. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.